And I want to personally thank you all for what you have done and what you have been doing to help slow the spread of COVID-19 in Mississippi. I know that everybody's holidays looked a little bit different this year, and it's a testament to the dedication of Mississippians that you chose to do that. Of course, the fellowship of a holiday season is going to bring more risk. I believe that the people across Mississippi, while they may not fully appreciate the downside risk, certainly understand that there was risk. We saw a steep drop-off in the total number of reported cases during the week of Christmas. I don't think it was because the virus stopped spreading. I think it was because fewer people were getting tested and fewer were getting reported. So I expect to see some very large numbers with the spread from the holiday gatherings, combined with the backlog in testing and reporting that may have occurred during the last 10 days. Right now, the most important task that we have is getting vaccines out to the public. That is our only way out of all of this. Of course, I still believe that everyone should continue to take social distancing seriously. But at this point, as a country, we need to stop trying to run people's daily lives through government orders and start focusing on getting the vaccine out to as many people as possible. Individual Mississippians can reasonably take steps to protect themselves and make informed decisions about risk in their lives. They cannot procure, they cannot distribute, and they cannot administer the vaccine. Only we can. And we need to focus our attention on doing just that. And I will tell you that is exactly what we are doing, and that is exactly what we are focused on. Admittedly, it's going slower than I had hoped. It's gone slower than I think everyone would have hoped. It's gone slower in Mississippi, and it's gone slower across the country than any of us wanted. But it is underway, it is ramping up, and we just need to step on the gas. We spent much of this morning discussing potential avenues of ways in which to do that, and I am convinced that it will improve. In my mind, part of the reason for the holdups is the CDC decision to hold back and focus on who should be getting the vaccine and who should get it first. We need to move fast, and we need to get it out there. We don't need to analyze and prioritize for months and months on end, all the while debating of who is more deserving than someone else. One decision that we discussed and ultimately made this morning, we're going to start allowing vulnerable Mississippians to have access sooner than might have otherwise occurred. Starting next week, those over the age of 75 will have access to the vaccine. Starting a week after that, those over the age of 65 will have access to the vaccine. We're launching more vaccination sites, and Dr. Dobbs and Jim, who is here with us today, will have more details on that. In fact, Jim was out, I believe, in Lauderdale County earlier today, witnessing some of the first facilities being open. We know that we cannot afford delays in protecting those who are at the greatest risk. We must focus on saving lives. And we know that those over the age of 65 are more vulnerable than those of us under 65. Also, just want to walk through a little bit of the data, particularly wherein there was some erroneous data that was spread over the last several days. It was reported that we had been delivered 190,000 doses of the vaccine. Now, I understand that this is nuanced, and I understand that the general public may not have fully appreciated all of the differences in wording, but I think it's important for my constituents to understand what these various terms really mean. there was not 190,000 delivered to Mississippi. There was 190,000, actually 189,250 that were allocated to the state of Mississippi thus far. Of those, 163,750 were distributed, at least initially, but of those 163,000, 78,000 of them were distributed to the partnership by the federal government through CVS and Walgreens that were designated for long-term care facilities. And therefore, Mississippi's enrolled providers have been actually shipped 85,750 doses. Of those doses, we've actually administered, and by administered I mean shots in arm, and again, this was at the latter part of last week, 21,653. That is approximately, of those that has gone through the State Department of Health and the enrolled providers, 20,548, or 28% of the total first doses that have been sent to Mississippi had been administered by the weekend. And of the nearly 78,000 through the federal pharmacy partnership, only 1,105, or 2.3% of those first doses had been distributed. I tell you that because I trust the people of Mississippi to understand the facts and the real numbers and know that we are monitoring this very, very closely. Neither one of those numbers, neither the total doses administered in Mississippi through our own enrolled providers or through the federal pharmacy partnership is good enough. We've got to do better. We all share that view, and we're completely focused on ensuring that we do exactly that in the days and weeks and months to come. And so our ask at this point of the public really remains very, very simple. Please keep protecting yourself and keep protecting your loved ones. Over the last several months, there's been a lot of discussion about where we found ourselves in terms of hospitalizations, in terms of number of patients in ICU beds, etc. And I've often been willing to step up and tell the people of Mississippi the truth. And here is the truth. We have more patients with COVID in ICU beds at the end of last week than we have had at any other period throughout this pandemic. We are in month 11 of positive cases in our state. Now, this wasn't true in the middle of November, and it wasn't true in the middle of December. But today it is true. We have more patients in ICU beds with positive COVID tests than at any time during this pandemic. Now, we have worked, and Dr. Dobbs has worked, and we have done various things, including reducing elective surgeries throughout the state. That has slightly reduced the total number of non-COVID patients in ICU beds. It has relieved some of the pressure, some of the stress, but I am here to tell you we are now in a very critical time, in a very critical situation. Everyone needs to understand, and I believe everyone in the state does understand, the risk of getting COVID. The risk of our hospital system and our public health system being overwhelmed. We are at a much greater risk today than we have been at any time during the pandemic with respect to hospitalized patients and ICU beds full. And that's why I ask you, please take precautionary steps to protect yourself and to protect your loved ones. We are going to get the vaccine out to anyone who wants it as quickly as we possibly can. And we're going to continue to work to convince more and more and more Mississippians of the efficacy of the vaccine, of what your willingness to take it will do to help not only yourself, but to help slow the spread. And that's something that we are going to work very hard to do in the coming days and weeks and months. With that, I'm going to turn it over to Dr. Dobbs to give us an update.
Yeah, thank you very much, Governor. So today we're reporting an additional 1,616 new cases and 13 deaths. Sadly, we did see near about 1,000 deaths in the month of December, as we thought might occur. We do strongly anticipate another surge following the holidays. It's kind of been a recurring theme. It's not something that should be too surprising. And this is also occurring when we have full ICU rooms. Our hospitals are really overburdened. So please be very careful. Those things that we do, that we know work, still work. So please wear a mask in public, avoid social gatherings, keep it small and keep it outdoors. If we look at our hospitalizations, we do have the highest number of COVID patients in the ICU at 355 on the latest report from yesterday. We have 1,369 COVID patients in the hospital right now in Mississippi. That's a phenomenal number. And we have seen a gradual decline in the number of non-COVID patients in intensive care. Part of the efforts we took, to decrease it in the efforts of hospitals, a 6% decline in a week. I would like to say thank you to folks working in hospitals, ERs, ICUs across the state. I see it every day. I've been visiting hospitals and seeing what's going on with them. They are stressed. So, be patient if you're waiting in the ICU, in the ER, because it may take many, many hours to get care. But most of all, stay safe and don't need an ER or ICU if you can help it. And please try not to get coronavirus. As we talk about the vaccine effort, the governor did a great job going over the numbers. We are a bit behind where we wanted to be. Part of it, we did have to move a good portion of our Pfizer allocation from week 1 over toward long-term care so we could activate that plan. And so that's about 13,000 doses that we didn't have to work with on the week of December 14th. Most hospitals got the majority of the Moderna vaccine right before Christmas, like the 22nd or 23rd. So a lot of this dosage that we have was actually, we just got recently, so it's not like we've been sitting on it. The hospitals have been doing a great job getting it out. They've been fantastic partners. They're continuing to give a lot out, not only to their own folks, but also other medical providers in their community. There also is a delay in reporting. We know that. And so any numbers that we have are going to be a little bit delayed. I did get an update from our immunization director just over the phone a minute ago, and we have now administered 23,511 doses in our surveillance system. The same thing goes with the long-term care system, where their reports, they have up to 72 hours to put it in our system. So there will be a natural delay. From what I understand, they had 24 nursing homes scheduled last week to get the vaccine and another 44 scheduled today. So we will look forward to them getting more and more folks vaccinated. When we talk about long-term care, people who are residents of long-term care catch coronavirus from employees. The visitation is pretty limited and safe. The employees are the mechanism through which folks can get COVID in nursing homes. So it's so very important for people who work in long-term care settings, work in nursing homes, to go ahead and get vaccinated now. It's safe, it's effective. I've had it. My wife has had it. She's a critical care doctor. And my son, who's a medical student working in surgery, got it too. So obviously I believe in it. And I really think and would admonish everyone who's working in healthcare, especially if you're with old folks, to please get the vaccine. And even if you work in a nursing home and CVS and Walgreens haven't come by yet, we want you to come to the drive-through clinics that we have at the Department of Health available. And I'll let Mr. Craig talk about that in a second. The last thing I want to mention is we're going to try to send about 20,000 doses, more or less, to private clinics this week who can start adding to that workforce of vaccinating not only our 1A, our healthcare folks, right? But next week we're excited, as the governor mentioned, to start offering it to 1B, especially people over 75. And so those appointments should be available on our website and our UMC partner website in the near future. So look forward to that happening next week. And Governor, with your permission, I'll turn it over to Mr. Craig to give more information on the drive-through locations.
Yes, thank you.
Thank you, Dr. Dobbs. Thank you, Governor. As we announced last week, we have 18 sites, health department locations around the state of Mississippi for vaccination drive-through of healthcare workers. Today, we had 3 of those sites that were activated down in Pascagoula in Jackson County, over in Lauderdale at Meridian, where I was, and up in Greenwood for LaFleur County. All 3 of those sites went off without a hitch this morning. It was really remarkable to see the number of healthcare workers that got there early looking for vaccine and to see their faces when they received that vaccine. It was a great day in Mississippi, without a doubt. So tomorrow, we will be in Adams County, in DeSoto County. We'll also be at the Lake Terrace Convention Center in Forest County, in Harrison County, Lee County, Lowndes County, Neshoba County, and at Trustmark Park in Rankin County. We have about 10,072 appointments currently in the system. 628 appointments were made today, and when I left Lauderdale around 11 o'clock, we had 0 no-shows. So everyone had showed up for the appointment that they had made. We will continue to have our teams from the Mississippi National Guard and the Health Department working these locations, and I can't tell you how much we appreciate the help of the Mississippi National Guard in this vaccination effort, as well as those public health nurses and others that are out there helping with this effort. But there are still appointments available. So if you're a healthcare worker and you're looking for an appointment, we have appointments available in the system right now in Batesville, Greenwood, Greenville, Laurel, Macomb, Natchez, Pascagoula, Philadelphia, and Starkville. So know that there are plenty of appointments out there. As Dr. Dobbs said, especially those that are in long-term care facilities. We know that those employees play a critical role in our long-term care residents' health. So it's really important for them to go ahead and get an appointment and come on down to one of these locations, and let's get them some vaccination. That's all I have, sir.
Thank you, Jim, and thank you to you and your team at the Department of Health for helping get us ramped up for more and more vaccinations being in those individuals' arms. Again, I want to just spend a little bit of time, because it's a debate and a discussion that we've had internally, and I think it would interest those individuals. I've said repeatedly today, and I'm going to keep saying it, that we should focus less on who is getting the vaccine and focus on the number of people that are getting it. But I do want to just talk a little bit about the decision to focus these initial doses on healthcare workers, even some of whom are younger and more healthy. We have, and we know, given the number of patients that are in hospitals and the number of patients that are in ICU beds, we know that we already have what is near shortage in total number of healthcare workers. They've been tremendous throughout this entire process. They've showed up under very difficult circumstances, and we thank them for doing so. One of the reasons that we focus this initial dosage on healthcare workers is very clear. Not only have they borne a large percentage of the work throughout this process and throughout this year, but also we simply cannot afford to have 5 or 10 or even 15% of them either with COVID or on quarantine for having come in close contact and being not vaccinated, because we need 100% of those workers that are currently employed and working to be at their shift every single day. The other thing I want to say, and I mean this, and I mean this in all sincerity. Dr. Dobbs mentioned it. If you work in a long-term care facility, your patients, the people that you work with, are oftentimes the single category of most vulnerable individuals out there, because not only do they tend to be older, they also are obviously living in a congregate setting where we have seen time and time again those who live in congregate settings are at higher risk than those of us who live individually. And so if you work in a long-term care facility, I urge you to please take the necessary steps to get the vaccine, because oftentimes what we've seen is we went from well over 200 long-term care facilities with an outbreak down to close to 100 back in September or in October, and now we're back up over 200. I hadn't seen the specific number in the last couple of days, but we're well over 200, and that is largely from workers getting the virus in the community and unknowingly taking it into the facility. So please, if you're in a long-term care facility, if you work there, we obviously have a significant allocated number for you, but we're urging you to go ahead and get an appointment and get that first dose of the vaccination as soon as possible. I am very pleased to hear the update of we have 10,702 appointments. What I want everyone to know is we're going to open this up to those over the age of 75 starting next week. But if we go a week or so and appointments are not 100% full, we're going to move even more quickly. Because again, we want to focus on getting as many people shots as is possible. At this time, we got some fantastic news over, I guess it was New Year's Eve, regarding Hurricane Zeta. I'm going to turn it over to our emergency management director and deputy director. We're obviously glad to have Greg back with us. As many of you know, Greg went through a very challenging December. He himself did test positive for the virus, and I won't go into any details, but this virus treats different patients in different ways, and there's no question that it was a difficult month for Greg, and we're just glad to have him back. We need him back, and we're glad to have him back. So, Director Michelle?
Thank you, Governor. It's great to be back. We did get good news about 2 hours prior to the strike of midnight on New Year's Eve. We got approval from the White House for our 11th federal declaration for 2020 for Hurricane Zeta. We were approved for both public assistance and for individual assistance. For public assistance, those counties were George, Greene, Jackson, Hancock, Harrison, Perry, Stone, and Wayne. And that again is for public assistance. So public assistance will be available to local governments and eligible nonprofit agencies to assist in the cost of emergency work and repair or replacement of disaster damaged facilities. Mississippi was also approved for individual assistance for the following counties: George County, Greene, Jackson, Hancock, Harrison, and Stone County. Individual assistance is available to residents in those counties and include grants, temporary housing and home repairs, low-cost loans to cover uninsured property losses, and other programs to help both individuals and business owners recover from the effects of the disaster. We've already had a lot of activity in the individual assistance portal on FEMA. Over 2,100 residents have registered and applied for individual assistance. Deadlines just to be making a note of for individual assistance. Homeowners will have until March the 1st of 2021 to make application for that. And with regard to public assistance, businesses will have until January the 30th to make application there. As you all well know, clearly we're still in a COVID environment, so most of what we want to do is being done virtually. You can apply online if you're eligible at www.disasterassistance.gov. And then there's a toll-free phone number that individuals can call if you need assistance, and that number is 1-800-621-3362. I say again, 1-800-621-3362. We will be opening physical disaster assistance centers. Those will, again, be operated differently. We'll be maintaining social distancing, requiring folks to wear masks, and do everything we can to prevent the spread, but we will be opening centers. Those centers will be rotated around through counties, and we'll have additional information that we'll be putting out as we get closer to opening those. Our goal is to try to start opening those centers up by Friday of this week. I want to remind individuals, if you come there to make an individual application, you want to bring the following things: your Social Security card, your contact information, driver's license, damage information to your home, any insurance information that you got, and financial information such as household income, before taxes, any banking and routing information that we might need. We'll be continuing to give you updates throughout the process, but that was good news for Mississippi, and we'll keep you updated as we move along.